Hi, good evening. I'm Lonnie Stonich, the Executive Director of FAN. We're a nonprofit that presents programming exploring human development across the lifespan. I'm honored to welcome you to tonight's conversation between Dr. Christine Crawford and Dr. Tramaine Presley. Thanks for joining us. FAN's YouTube channel has an archive of over 350 videos of past events, so be sure to subscribe to the channel to get updates when new recordings are posted. And now for some introductions. Dr. Christine Crawford is the Associate Medical Director for the National Alliance on Mental Illness, known as NAMI, the country's largest grassroots mental health organization. She is an Assistant Professor of Psychiatry and Vice Chair of Education at the Boston University School of Medicine. Dr. Crawford also provides outpatient psychiatric care to children and adolescents at Boston Medical Center. Additionally, she is the Medical Director for the Boston Public Health Commissioner's School-Based Clinician Program, providing direct guidance on how best to support the social-emotional well-being of children within the Boston public school system. I'm surprised she has time for us tonight. Dr. Tramaine Presley is a clinical psychologist by training and a licensed clinical professional counselor of Illinois and Indiana. She has 13 years of clinical experience and proudly serves as the Director of Child, Adolescent, and Family Services at the Family Institute at Northwestern University, a not-for-profit behavioral health organization affiliate with Northwestern. Dr. Presley has worked with children, adults, and families across a variety of clinical settings: private practice, community mental health, residential, schools, college campuses, and hospitals. The Family Institute is a proud sponsor of FAN as well. And now let's welcome Dr. Christine Crawford and Dr. Tramaine Presley to FAN.
Dr. Crawford, I am so excited for this conversation. I've been waiting for this conversation to happen. So thank you so much for joining us. Thank you for taking time out of, I'm sure, your busy schedule to engage with me in dialogue about a topic that I think is so important. First, I want to start by saying this book, okay? This book, this piece that you've produced is such a gift to the field of mental health. It is a gift to the field of psychology. It is a gift to parents and caregivers of all kind, educators, faith leaders, and any person working with young people. And so I want to say thank you on behalf of all of those people. Thank you so much for providing us with this timely piece. This book is exactly what it says. It's a guide to better understanding mental health for children and adolescents. So share with us a little bit about your journey, what inspired you to write this book. Did you find that something was missing in the conversation about children's mental health and that you wanted to address through this book?
Well, thanks so much for that amazing introduction. I'm so happy to be here. And also, I should have you as my hype woman and just kind of put you in my pocket and just go around town trying to sell this book. That is fantastic. So thank you so much for those kind words, especially coming from a seasoned clinician. That's so meaningful, because the whole point of this book was to appeal to a general audience who might not have basic mental health knowledge, and to also appeal to the clinicians out there as a reminder of all of the basic things that are so essential for connecting with young people, for understanding young people, for communicating to them and their families. And so I'm so encouraged by the fact that you found it to be helpful. Now, as a child psychiatrist, I'm basically a unicorn in the United States of America. There are not that many of me across the country. There are about between 8,300 to 10,000 child psychiatrists across the country, and most countries have a severe shortage of child psychiatrists. Now, I work and practice in the city of Boston and Massachusetts, and in my state, we have more psychiatrists than 5 other states combined. And so what I know to be true is access is a problem, and it's terrifying for a lot of families when they have mental health challenges that they see in their kids and they don't know where to go or what to do. So I wrote this book because I know that there are so many families out there across this country who are struggling each and every day, trying to figure out how to best support the social emotional well-being of their kids, how to support their kids who might be facing mental health challenges while they're living in a country in which access to mental health clinicians who work primarily with kids is so limited. And I also wanted to provide tools and strategies and resources to families that they can incorporate in their daily interactions with their kids to prevent the development of significant mental health symptoms and mental health conditions, and to feel empowered to teach their kids with intention about how to take care of their mental health and how to communicate when they're struggling with their mental health or with their emotions or how they're behaving. And so I know that families are desperately looking for answers to their questions. Google isn't doing it, TikTok isn't doing it, Instagram, YouTube, all of that, right? And a lot of parents feel like they have to diagnose their kid in order to buy the right book. Do I think my kid has ADHD? Do I think my kid is depressed? I don't know. I'm just going to go to the bookstore and pick up one of each about all of these conditions. But this book really talks about how to think about youth mental health, how to know if your kid actually has a mental health problem that you should look into, how to figure out, is this more of a problem about me and my anxiety, or is there something actually going on? And then what do mental health conditions actually look like in kids across their entire childhood, starting from preschool age all the way up until they're in high school and they're 18? Because it looks different when we're talking about anxiety in a 5-year-old versus an 18-year-old. So the idea of having one book that as a parent, as a caregiver, as a teacher, as a clinician, that you can have that will cover everything that one ought to know about mental health was really the inspiration about that for writing this book, because folks want answers. They are so desperate. And I hope that this book will provide some of the basic answers that they need in order to better support their kids.
Absolutely. I want to say that this book could not be any more timely following the release of the U.S. Surgeon General Advisory, the release on the Parents Under Pressure, right? Talking about parents are under enormous amounts of pressure, experiencing an enormous amount of stress, and just carrying out their role as a parent and caregiver. How do you think parents' understanding of mental health has evolved over the past decade?
I really like that question. I think that it's evolved not only because of the pandemic, and I think that the pandemic really highlighted the ongoing and existing challenges that kids were already dealing with, but they were so magnified because the supports, the coping systems and strategies that kids were using in order to navigate various stressors, all of that was removed. And then there was also a sense of uncertainty that a lot of people, including kids themselves, were facing about what the next day was going to look like, what their future was going to look like. And they were lacking a set of tools to be able to cope with all of that. And in
Mhm.
addition to that, and for many years, adults have been struggling. And kids learn how to cope with emotional stress from the adults in their lives who are serving as models. They are watching us each and every day to better understand, how do I deal with disappointment? How do I deal with uncertainty and anxiety? How do I tolerate really big and intense emotions? And I think that over the last few years, over the last decade, because adults are recognizing that it is a struggle for them to cope, that they're also appreciating the fact that it must also be a struggle for their kids to cope as well. I also think that over the last decade, we've had so many conversations about mental health in open spaces. And I really appreciate how we've normalized kind of the experience of feeling stressed out, of having periods in which it's hard for you to function. I'm really encouraged that during the pandemic, again, more and more of those conversations were happening because the mental health of adults was getting in the way of people's ability to show up to work, to function, to go to school, to take care of their kids. So we weren't able to ignore some of the challenges that were being faced. But I do think that it continues to be a struggle for a lot of parents to perhaps accept the fact that their
Mhm.
kid might be struggling and then to take the next step to get their kid into the help that they need. Because there's oftentimes a fear that if your kid is struggling with their emotions, with their behavior, that that's a direct reflection of your parenting ability, your parenting skills, when really what we need to do is to shift our mindset and our thinking around when kids are struggling emotionally, that doesn't automatically mean that we're doing something wrong. And I think it's really hard for a lot of parents to understand that. And that's why I think that there are still so many kids who aren't being brought in to help to get the treatment that they need because there's a lot of worries, fears, and concerns on the part of the parent, even though we've come a long way in terms of having these types of conversations.
That's good. That's good. I will say, right, this book, the breadth of this book, the depth of this book, there's no way that we can cover it all, right? So I'm gonna try my best. I'm gonna try my best to really, hit on some of the, I would say, common themes that show up in this book that you touched on. So just to kind of start off, right? In the intro, you encourage parents to get curious, right, about their child's mental health. Talk to us a little bit about distress signals, right? You mentioned from a very young age, we learn how to signal to caregivers when physical needs arise. So, just in the way in which we do that for our physical needs, you allude to, we do that with our emotional needs too. So talk to us about distress signals. What are distress signals and what are some distress signals parents and caregivers can start to notice to really start understanding, hey, my child might be struggling with a mental or emotional health issue.
Yeah, so I talk about distress signals because a lot of parents and caregivers have a hard time being able to distinguish between typical child behavior, typical adolescent behavior, and what might actually be behavior that might indicate that something more is going on. And a lot of people struggle with that. And when they struggle with that, it often leads to delays in getting the kid into help, delays into intervening and providing them with strategies for how to cope. So I came up with this concept of distress signals so that it could be very easy for parents, caregivers, and adults to be able to quickly recognize and identify when their kid might be experiencing distress. Before I elaborate on that concept a little bit, I just want to kind of go off on a tangent and just talk about the reason why I keep using the term caregivers. I strongly believe that when it comes to raising kids in any society, that there needs to be a shared sense of responsibility in the upbringing of kids. So I think that any adult who's invested in the well-being of a child is a caregiver because we are all serving as models each and every day, whether we are basketball coaches, whether we are the fun auntie bringing them to go shopping and to get their hair done. We are caregivers. We are taking care of these kids. We're modeling for them. We are connecting with them. And we are part of raising them. And so caregivers can be anyone, including teachers, no matter who you are. So that's why I like to use that term, even though more commonly it's been used to think about caring for an adult child, or caring for a parent or someone else. But I think about caregivers as anyone who's, again, invested in supporting the social emotional well-being of our young people. There's a shared sense of responsibility in that. But returning back to the concept of distress signals, um, kids are really challenged with the ability to put into words their internal experiences. We are there to teach our kids over time the language to use to communicate how they're feeling inside. And this is a process that begins even when kids are very young and they're in preschool and they're learning to label emotional states. They're learning how to recognize emotional states in other people and in themselves. And they're taught to label them so they know what angry looks like or sad looks like. And so they're already learning those words. And I encourage people to teach kids how to recognize what anger or sadness looks like for them and what it feels like in their bodies. But again, kids really struggle with acquiring that language very early on in life. And so what they do instead is they communicate their distress by using their body. And they make it very well known to other people that they're not doing well. And that's how they communicate how they are feeling inside is through their bodies. And so if you notice, especially talking about preschool age kids and school age kids who are oftentimes left out of the conversation of youth mental health. I feel like for years we've been focused on adolescents, on teenagers, young adults, and we should be, absolutely. But we know that 50% of all mental health symptoms present prior to the age of 14. And so we need to appreciate the fact and understand that kids who are in elementary school are struggling and we can intervene during that period of time. But if we're not able to notice these distress signals or to be curious about changes in their kids' behavior, then we're going to again delay the opportunity to intervene. So I know, Dr. Presley, I'm like, this is long-winded answer, but I'm getting there. All right. But in terms of what the distress signals look like, so for a kid who might be in elementary school, a school age kid, again, they don't have the language to be like, I'm sad, I'm upset. We're teaching them how to, but it's a little bit of a struggle. If you notice that your kid appears to be more tired, that they're no longer interested in doing things that they would usually enjoy, like going to their friend's house or going to soccer practice, if they seem to not be as interested in eating, any sort of changes that you notice in the pattern of your kid's behavior, to me is a distress signal. It doesn't have to last for that long. If you notice these subtle changes over the course of a couple of weeks, that could be the signal that something else might be going on. So, again, the distress signal is any deviation from their pattern of behavior that is notable. The other thing, too, about some of these subtle changes, whether it's how they're functioning, how they're getting through the day, what their mood state is like, to be curious about why there is a change in this pattern. And for a lot of parents and caregivers nowadays, we're all too busy. We're all busy. We're all looking at our phone, checking our emails. What's going on? Responding to emails as your kid is talking to you. And we're just so quick to provide immediate reassurance or to not even notice or to be like, oh, yeah, I noticed that they haven't been going to their soccer practice for a while, but who cares? Who cares? We got to be curious about some of those changes. And we can even ask our elementary school kids about that. Same thing when it comes to middle school and high school kids who are a little bit more advanced in their ability to communicate their internal distress. But you can say things like, I've noticed that you've been a little bit more moody lately. You've been spending more time in your room. I'm really curious about some of those changes. What do you think is behind that? And they might actually be able to communicate to you what is going on, why these changes are occurring, and then that can give you an opportunity to connect and to provide them with support. So basically, any changes that you notice, to be curious about it, to not let it go on too long. And parents and caregivers know their kids the best. Like parents and caregivers are the experts in their kids because you see them all the time. You know their patterns. So if anything deviates from that, feel empowered to approach your kid about it And it might be an opportunity to connect and provide them with support.
But you know what, Dr. Crawford?
Call me Christine. It's all good.
So, I think sometimes, and at least within my clinical practice, sometimes I hear parents say, well, they're a teenager, so they attribute the moodiness to it being developmentally appropriate. They attribute the withdrawal to being developmentally appropriate. Talk to us about what is developmentally appropriate and when should we be like, okay, it's developmentally appropriate, but this has been going on too long. I'm concerned.
Yeah, no, it's a great question, especially as a psychiatrist who primarily works with psychotic teenagers. I hear about this all the time because kids who are experiencing psychosis, teenagers who are experiencing psychosis, they have some symptoms that can happen prior to their first major episode of psychosis that a lot of parents kind of minimize or they kind of overlook, and they oftentimes label it as, oh, they're just being a typical teenage boy, I guess. So I do hear this time and time again. The bottom line is when it comes to the development of an adolescent, it is socially appropriate for them to not want to be interested in spending a whole lot of time with you. Okay. Totally developmentally appropriate that they're more interested in hanging out with their friends and being able to get kind of their emotional support from their friends. They prioritize their friends because they want to feel accepted. They want to feel like they belong to their peer group, and that is a priority. So, if you notice that your kid, your teenager is becoming more withdrawn, they're spending more time in their room, and that's all that they're doing, but they're still hanging out with Susie, Bobby, and Billy. They're going to the movies, they're going bowling, they're doing the most. That's one thing. That differs from a kid, a teenager, who's becoming more socially withdrawn and they're not going to school, they're not eating, they don't even want to talk to any of their friends, they're no longer going to any of their activities. That's different, right? And so that's why I kind of talk about the distress radius, this concept in the book that really touches on how do I know if this is typical behavior or if this is a problem, right? So if you see something that you're concerned about in terms of a change in your kid's behavior, but it's starting to spread out and have an impact in multiple areas and domains in that kid's life, then that's a signal that something is going on. So like that example of the kid is being moody, they're keeping to themselves. But if we're seeing teachers giving you calls from school being like, he's sticking to himself, he's not wanting to talk, he's talking at me, being oppositional, they're no longer going to church. And you're hearing from the youth pastor that they're running their mouth. You see what I'm saying? How it's kind of expanded out way beyond just the confines of the home. And that communicates that there's something else going on. So I like to use that kind of that visual of like the distress radius. If it's getting bigger and bigger and is starting to impact various domains of this kid's life, then that is a signal that this is not typical teenage or childhood behavior.
Yeah. Talk to us about, okay, I'm a parent. I notice something's going on with my child, and I need to have a difficult conversation about what I'm seeing, what I'm noticing, right? Also, thinking about those that need to approach their child about their behavior and question what's going on with the fear or the angst that this will, draw them further away, right? Talk to us about how do we go about having these difficult conversations or these challenging conversations about what we're observing or that we're concerned about our child.
Well, so you already can tell I'm quite long-winded, so I'm going to give this a very thorough explanation here, right?
Well,
So when it comes to talking to your kids about their mental health, everyone should be having these conversations from the jump when kids are very young. when they are preschool age, when they are 3, to start having those conversations. Because when you start having them young, or when you start having them before there are any issues or acute concerns that pop up, they are more likely to approach you when they start to notice some subtle changes in their mood and behavior. And so it allows you and your family and the kid to be more proactive in your approach to supporting their mental health needs. So have these conversations early, have these conversations often, and also model how to have these conversations even when nothing is going on. And so, for example, what that could look like with young kids is to sit down. Oftentimes in the car is the best time to engage in conversations with kids about their mental health because they're not going anywhere and it's a captive audience. They're strapped in, they got to talk to you. So that's oftentimes a really great place to do it. But to say, "Oh, Sally, I wonder how have you been feeling?" The reason why I asked you is because I've been feeling really stressed out and overwhelmed lately. I have a lot of things going on at work, so I noticed that I've been a little bit more distracted at home. So I'm just curious, how have you been? So number one, you're asking about them. You're kind of planting that seed of like, I'm interested in better understanding what your experience is like each and every day. But also, I'm going to be vulnerable with you and share with you some of my challenges, as well as insert some pearls around how it is I'm going to support my mental health and how I'm going to navigate this particular struggle. So you could say, I'm really stressed out, I'm overwhelmed. And so, what I'm actually going to do is I'm going to go to this workout class after dinner because I notice that when I move my body, I feel less overwhelmed and stressed. What tends to help you when you feel overwhelmed and stressed, right? And so that's a conversation that you could just have on the regular, right? Now, a lot of parents are worried that if they start talking about mental health issues out of the blue, just out of the blue, and you have like a 15-year-old and you have some concerns about their behavior, you're like, man, how am I going to approach this? Because what they're going to do is they're going to do a whole, "Mom, leave me alone. Like, you're making a big deal about this." And then they'll storm off. Okay.
Mhm.
Now, that might happen. That might happen, but it doesn't matter if it happens. It's more important for you to actually have the conversation than to not have it. More harm will be done by not engaging in the conversation rather than having the conversation. So, you bringing up mental health isn't you communicating to them, "Oh, you're fragile," or "I think you're going to do something bad," or "I don't trust you to take care of yourself." What you're actually communicating to them is, "I notice you, I see you, and I care about you, and I care about your mental health." So, first and foremost, have the conversation. Number two, when you're having the conversation, approach it with kind of this framework that I talk about in the book. I talk about look, listen, and lock in. And so the whole look piece is what you've been doing each and every day as a parent. You're looking for these subtle changes in their behavior, as I already talked about with the distress signals. So you've already noticed this pattern. And then when you approach a conversation, you want to approach it from a place of curiosity and a place where you're going to be doing a lot of listening. Now, as parents, we like to make certain assumptions about some of the patterns of some of the changes in behavior that we might observe. So, for example, if there's like a 15-year-old and you're noticing that they appear to be a little bit more anxious, you could say to them, "I notice that you are so scattered brain, you keep forgetting everything. I think you're super anxious about this. About trying out for JV volleyball. You shouldn't be anxious at all. You should not be anxious. You'll totally make the team." And so you kind of close the door because Susie Q might actually be anxious about a whole nother thing, or they
Mhm.
might not even be anxious at all. But you are quickly labeling the behavior change that you're noticing. You are kind of assigning a label to it. And you're also assigning judgment to it, right? And that closes the door. And that doesn't really allow you to listen from a place of curiosity. So to say, I noticed that these are the changes. What are your thoughts about what's behind that? I noticed it over the last couple of weeks. And then they might tell you, well, it turns out that I was bullied the other day and it was awful. It was in the bathroom and I'm so embarrassed about it. You wouldn't have known that if you just jumped into being like, I know what's going on and I'm going to squash it, right? Um, Now they might say to you, oh, I'm fine. Everything is fine. Leave me alone. But at least you have planted the seed that I've taken notice of you. I care about you. I'm interested in talking to you about it. And then you're going to follow up on a regular basis and check in and be like, just want to check in. I've been having some difficulty. Just wanted to see how you're doing with everything. Mom, I don't care. I don't care about your difficulty. Pay for a therapist, right? It doesn't matter the response because what you are doing is you're watering that seed, right? And you are being persistent. You are demonstrating that you are very much interested in having this conversation. And it might not be until a month later, 6 months later, where they finally come up to you and be like, Mom, I really do want to talk to you about my anxiety. So we have to be patient. We have to be available when our kids are ready. And this is in the setting when there aren't any acute, kind of emergent, kind of urgent issues. But sometimes the waiting game actually is better when it comes to our teenagers in terms of waiting for them to come to us, but just planting the seed and watering the seeds with all of those interactions.
It made me think of how do educators, right? I want to, speak, directly for educators in terms of, you know, they're with our kids for a large amount of time in the classroom and in the school setting. How do educators initiate conversations, or is it okay for educators to approach a child about some concerns that they're having? In
I
terms of what they're saying. Yeah.
Yeah, I love this question. So for the book, I actually interviewed over 80 people across the country over the course of a year and a half. And I interviewed a number of educators, and actually they were part of the first group of people that I had interviewed because I strongly believe that educators, teachers, coaches, school administrators, they are all on the front lines of this youth mental health crisis. They are seeing these kids for many, many, many hours a day with very limited resources and skills and tools to be able to support them. But they're seeing this in their classrooms. And obviously, it got worse during the pandemic. And while that was happening, teachers were also overwhelmed trying to play catch up with all these students to bring them up to speed. And so, teachers, educators have been in a difficult position because they not only have to educate kids who are struggling to learn, but they also have to educate kids who are struggling to learn because of mental health challenges too that aren't being fully addressed. They are also the ones who bring up the concerns and raise the concerns to the parents. For a
Mhm.
lot of parents, they don't know what's going on until they get a phone call from the teacher. And a lot of parents are working multiple jobs or trying to support other kids. And sometimes they're not even fully aware that their kid is exhibiting some of these changes in their behavior and in their mood. And so, what I tell a lot of teachers, and what I've heard from some of the teachers that I interviewed for this book, is that you have to, as an educator, address the mental health needs of your students. You can't be an effective educator if you have kids who have their heads down, who are not engaged, who are very distracted. It's hard to get them to learn. And so, what I say to educators is it's actually worth investing the time, whether it's 10 minutes, 15 minutes, whatever it is, to do a check in on people, to do a check in on your students. There were teachers who I interviewed for this book, would talk about how they would set up their classrooms and have sensory areas in their classrooms where there would be beanbag chairs or there would be different type of lighting or there would be fidget toys to be able to check in with your student, to acknowledge the fact that they're having a difficult time and ask, would you like to go to the sensory corner? Would you like to take a time out and come back and rejoin the class? Just to check in and to ask those questions and to offer an alternative experience for the student in the classroom, I think is totally okay. Because it's not like the teachers are going up to the kid being like, I think you have this. You
Mhm.
ought to do that. It's more like, I'm seeing you're having a tough time, right? And I think students would actually appreciate the fact that an adult in their life actually notices them and cares about them and is providing with some options for them as well. I'm not suggesting that teachers should be mental health clinicians and start diagnosing kids and start doing cognitive behavioral therapy or dialectical behavioral therapy in the classroom. I'm just saying teachers should notice how their kids are behaving, what moods are kind of coming up to the surface, to be curious about that. And that's it. That's a lot more than a lot of teachers are able to do because they are so tight on time and they're really doing the best that they can to kind of meet the educational requirements that are placed upon them. But I think just taking the time to check in on students, I think can really go a long way.
Let's talk about therapy. So, chapter 3, starting the journey. I want to talk about the misconceptions that people have about therapy. And some people are on the fence about therapy. And so, in your book, you quote, "Why would I pay someone to simply talk to my child? Couldn't they just talk to me?" I hear that all the time. What is therapy, Christine? How can talk therapy, better yet, play therapy, which is a therapeutic modality, be helpful?
Yes, and certainly feel free to chime in too, psychologists, so you got the answer too here. But the way that I think about therapy and the way that I describe it to parents and caregivers is that it's an opportunity for your kids to learn concrete skills on how to support their emotions, how to manage their behaviors each and every day. Is literally about providing them with tools that they can use if they feel overwhelmed by intense emotions, right? And I think when it comes to the social emotional development of kids, we oftentimes like assume that kids are just going to figure it out. They're going to just figure out how to deal with stress, anxiety, sadness. I don't know, through osmosis. They'll just figure it out as they grow up. But I think that it's really important to be intentional about providing tools for our kids to be able to navigate this very complicated and challenging world. I imagine kids as having an empty toolbox that they're just filling up as they're growing up by
Mhm.
tools that they're learning from all of the adults in their life. And therapy is a very efficient way to fill up your kid's toolbox, right? And so it's not just about chit chatting, it's about skills building. It's also about developing the skill on how to talk about your emotional state and to feel comfortable communicating your emotional needs to other people. A lot of parents don't know how to do that, and that's okay. That's okay. And a lot of parents are struggling with identifying skills for how to navigate daily stresses, and that's okay. And so being able to learn those skills from a professional who thinks about these skills each and every day is actually great. The other thing about therapy is that it's an opportunity to have space that's dedicated for your child to only focus on your child's mental health. When it comes to an interaction between you and your kid, it's a certain dynamic where there's a back and forth, right? You have feelings about the situation. They know you have feelings about the conversation you're having. So they might kind of adjust what they say to you, minimize what they say to you, because they're thinking about your feelings. In therapy, it's the only time that you have to communicate your emotional experiences, your thoughts, without having to worry what the other person is thinking about you in response and having to modulate yourself. It is a free time for you to just share whatever is on your mind without having any worry of judgment, fear of, you know, um, them not liking you and all these things. So it really makes it easier for kids to be forthcoming about how they've been feeling, about difficulties that they're facing, and things like that. Play therapy is amazing because, as I mentioned before, young kids in particular really struggle to put into words their internal experiences. And so using play allows you to be able to see into the child's mind and to get a window into how the child is thinking, how it is that they are interpreting different experiences that they've had, what it is that they might have been exposed to in the home or elsewhere. And so kids use play as a way to communicate with us, and it's easier for them to communicate with us, playing with various toys. And it allows therapists to be curious about some of the patterns that we're noticing in the therapy and wondering if it's reflecting something else that's going on in the kid's life.
So I do I'm like, man, where do I go? Got so many, you made so many great points. Let's switch gears for a little bit. And I want us to differentiate between that of a psychiatrist, psychologist, therapist, social worker. So your book, you do a really great job of laying that out. But you don't know how many times I got people, can you prescribe medication? No, I cannot. No, I cannot. I cannot. So help us understand the differences between all of those, so that we can understand, maybe how do we start looking for and starting this journey of looking for the right mental health provider for our child.
Yeah, that's what makes mental health very confusing for a lot of people because there are folks who have never interacted with the mental health system in the same way that most people interact with the medical system, in the sense that everyone grew up going to see their primary care provider when they were a kid. They would go to the pediatrician or the pediatric nurse practitioner, whatever, but they have a clear understanding as to what the role of a medical provider is, right? But when it comes to mental health clinicians, there's so many different types, so many different disciplines. And if you've never had any exposure to any of them, it can be somewhat overwhelming. And a lot of people are kind of lumped into the same bucket, right? But in terms of differences, and I'll start off between a psychiatrist and just talk about what a psychiatrist is. So a psychiatrist is a medical doctor. So they have either a MD or a DO. So what that means is we went to medical school. So when I went to medical school, I thought I was going to become an OBGYN. So that just gives you a sense here, right? So you go into medical school, you know that you want to become a physician, you know that you're interested in learning anatomy and physiology and how the body works and how medicines can alter the physiology of the body to make it work better, to heal it. And so I was very interested in being a healer using the power of medicine and understanding kind of the underlying medical issues that can have an impact on one's physical well-being. But while I was in medical school, I was really attracted to the field of psychiatry because I noticed that a lot of my patients, when I was doing surgery or neurology or what have you, the sickest patients were also patients who had underlying mental health issues that weren't being addressed. And sometimes those mental health issues were due to underlying medical conditions like thyroid issues, or they might have had a tumor, or other things that altered their physiology such that they need medicines or need medical treatment in order to improve their overall mental health. And so I learned a whole host of tools when I did residency after I graduated from my 4 years of medical school and did basically 5 years after medical school to become a child psychiatrist and an adult psychiatrist. And during my residency training, I was trained extensively in all types of therapy, play therapy, cognitive behavioral therapy, all of these different types of therapy, couples therapy, family therapy. But also, I learned about all the different psychiatric medications and how they can be helpful in terms of improving one's overall ability to function so that they can then engage in therapy. A lot of people have strong feelings about psychiatrists, especially when it comes to child psychiatrists, because they think we're just medicating away all of the problems that are caused by society that are impacting kids. That's what a lot of people think. But the way that I think about it is that kids are really struggling with their ability to function. Yes, we want kids to be able to learn certain tools through therapy, but if they're not getting out of bed, if they are not sleeping, if they are not eating, they can't sit through a whole hour-long session each week on therapy, right? They're not going to school. If they're not maintaining friendships and relationships, they're not learning what they need to learn in order to grow up to become a thriving adult. So I see medications as a way to get the kid to a point, a position in which they can actually acquire those skills that they can keep for the rest of their lives on how to deal with various mental health issues. So that's the way that I view medications. Some kids need them for a short period of time, and some kids need them for a little bit longer. But I use medication to help kids function. That's really what it is. I'm not using medications as a way to make their lives easier. However, I'm making it easier for them to function so that they can access the skills. Now, with therapists, and when we talk about therapists, there are a lot of different disciplines who provide therapy. So you had mentioned social workers who can be independently licensed or not, licensed mental health counselors. And we also have psychologists who can have a Psy.D, which is a PSYD or a PhD. And so when it comes to our psychologists specifically, our PhDs and our Psy.Ds, and I know that this is your area of expertise, but you all are the experts when it comes to psychotherapy. You all do extensive clinical research understanding the brain and human behavior and why people act and behave a certain way and what are some of the actual tools and strategies that are super helpful. And you do a lot of research in that while also researching various therapeutic interventions. And then our social workers, licensed mental health counselors are more focused on providing individual therapy or group therapy. And I work with a group of social workers and licensed mental health counselors who work inside of the schools in Boston through the Boston Public School System. And they see students inside of the school every week, and they're providing psychotherapy. And like I said, most of those are social workers and licensed mental health counselors who do not prescribe medications, only psychiatrists do.
Thank you. So, there's some good therapists out there, and there's some that might not be the best fit for your child. There are some better fits in terms of psychiatrists. There are some that just may not be a good fit for your child. How do parents identify who is most appropriate, who is qualified, who is certified to best work with my child? I get this question all of the time. What is it that I'm looking for? What questions do I ask? How do parents help parents give us some tips? How do parents identify a mental health provider for their child?
Yeah, I like to just keep it really simple because a lot of parents spend a lot of time on Google searching best therapists like in the country or whatever, or they're just kind of spending a lot of time doing all these searches, what have you, right? To save time, go to your primary care provider for your kid, honestly, because oftentimes there are therapists who work within the health center that your primary care provider is at, or they have a direct connect to therapists in the community who also may accept the same insurance that your primary care provider takes, and they might be in network. So that actually is the more efficient way to do it. I do know that a lot of families are calling up the insurance company, figuring out who's in network. You can do all of that, but I oftentimes just say, keep it simple. Ask your primary care provider, who do you know takes this insurance, whatever, and they can probably give you a list of some folks in the area. So you could start off with that. The other thing is, say if they do refer you to somebody and you're like, how do I know if this person is a good fit? Which is, to the question that you had asked, is when it comes to therapy, the connection between your kid and the therapist is very important. And if there isn't a strong connection, then it's going to be really hard for your kid to want to engage with the therapist and to be able to learn the tools that they need to learn. And it's hard for the therapist to understand what's going on if the kid isn't going to open up. So, what I talk about in the book is if you notice that after a period of time, you're bringing your kid in and there's not a good connection, I also recommend that you set up meeting times with the therapist because they're just going to meet with your kid individually, and you might not have time at the beginning or the end of the session to connect, but to reach out to them and be like, can we set up a time where it's just you and me? And you can ask, how has it been going? Do you feel like you're able to connect? Or you can share to the therapist, I'm worried that my kid isn't connecting with you. They told me that they don't feel comfortable. And you can have a frank and open conversation about it. After having that conversation, if you still aren't noticing any progress or you're concerned, it is okay to go to another therapist or to even ask the therapist if they have a recommendation for someone else who could be a better fit. I just want to normalize that process and experience of switching therapists. The feelings of the therapist will not be hurt in any sort of way. We actually encourage you to do that. It's fine to have an open and honest conversation about what's not working, but to don't feel like you have to force it unless there's like no other therapists around and all these other things. But I do want to normalize the experience of having an open conversation about what works, what isn't working, and to feel comfortable to find another therapist. And that's totally normal.
Thank you. So I'm mindful of time, and there are a few things that I would like for us to just address because they are alarming. The information, the research, the data that you shared in your book is alarming. And so I'll read. According to the CDC, nearly 19% of high school students aged 14 to 18 seriously considered attempting suicide in the last 12 months. Suicide is the 8th leading cause of death among children 5 to 11. And so within this group, those who complete suicide are more likely to be Black males. Also, suicide rates among those younger than 13 were 2 times higher for Black children when compared to white children. What is going on, Christine? What is happening to children as it relates to suicide completion? What is going on in the Black community as it relates to these high rates of suicide for children?
I think a couple of things. I think number one, we're actually studying that demographic. When it comes to suicide research, I feel like there's been a lot of focus and attention to an older population. And historically, when we would think about people who would think about suicide, attempt, or complete suicide, the person that would pop into your mind was an older, unmarried white male, right? But as over the years, we've been doing more and more research, we're kind of moving the dial in terms of the age and getting younger and younger. And so now we're able to capture young people as young as 5. The other thing too is that I think that people might be a little bit more forthcoming about what is actually going on with their kids. So there might be a change in the data that we're actually able to acquire. And I also just think that the realities that Black kids face each and every day, Black and brown kids, and just kids in general, but especially our kids of color who are experiencing ongoing bouts of racism, who are experiencing various forms of oppression, and their parents are as well. And the stress of that is having an impact on their overall mental health. And we do know that racism is a form of trauma. And so I do think that's compounding some of the existing mental health issues that are impacting all kids, but I think it's making things worse for this patient population. So I think it's a lot of the research, the data, and just the realities of being a Black kid in America.
Thank you. Thank you. Right. Last question. Finally, what is the one thing you hope parents take away from your book after reading it?
What I want them to take away from this book is that parents and caregivers are really kind of the main drivers when it comes to supporting their kids' mental health needs. It is not a passive experience. It's not, I'm going to make an appointment with Dr. Crawford, wait 6 months, bring the kid in for the appointment, wait for her to tell me what's wrong with the kid, and then sit back and see my kid in treatment. It is not that, and it cannot be that. It has to be an active process and experience with the parent, because you are going to be seeing the kid each and every day outside of that 20-minute follow-up visit that I'm going to be seeing them. And so I want parents to know that it is possible to learn the tools and the skills for how to take care of their kids and how to communicate effectively with the mental health providers in their kids' life, and that they should feel empowered to advocate for their kids. And I hope that this book will provide them with all of those tools in order to do so.
Dr. Presley, thank you so much for your great preparation and your conversation tonight with Dr. Crawford. I know there's just piles and piles and piles and piles of information. I know it probably felt a little daunting. The book is chock full. It's such a great resource, such a great service, Dr. Crawford, that you've provided to people who are able to have access to the book. And thank you so much for taking time out of your, what is an incredibly busy schedule, to spend time with FAN and our community, our national community, and talk more about your work, but also talk about many, many, many important topics throughout the past hour. I want to remind everyone that both Dr. Presley and Dr. Crawford will be joining after hours tonight. It is another 55 minutes spent with these two brilliant women, clinicians, both of them, where you can ask questions. I can probably, though I don't think I'm incorrect about this, I will say that they're not going to offer individual advice about your particular kid. That's not, they're too professional to do something like that. They're going to keep things fairly general as opposed to what might be happening in your own individual home. But as you can see, they're deeply experienced, quite compassionate, and really knowledgeable individuals. Buy a copy of Dr. Crawford's new book. We've been talking about it. It's everywhere. It's behind her as well. We've been putting links in chat. Buy a copy from the bookstall. You'll get a link to register for after hours will be in the receipt from the bookstall. So we're just at 7:59. I think I'm just going to hand it off to you, Dr. Crawford. Is there anything you want to say as we close out in your final minute here?
Youth mental health is contingent on adult mental health. So everybody take care of yourselves. Really lean into the opportunity to take mental health days and to take care of yourself. So make sure to prioritize your mental health if you want to take care of your kids.
And keep coming to those FAN programs about mental health. Free and open to the public. There you go. Thank you both. We'll see you in about 5 minutes. We're going to give both of them a nice 5-minute break. We'll open up the after hours room at about 8:05. So thank you everybody for joining. And, great program tomorrow night. DeMar DeRozan, big NBA superstar who came out about his depression and his struggle with depression and anxiety. So these are back-to-back programs, both very powerful, different angles, but very powerful. Hope to see many of you tomorrow night as well for DeMar. So thank you everybody and good night.